questions that our patients have after surgery. So these are just compiled, the most frequently asked questions. And one of the biggest questions we have here is, what is the number one reason for weight regain after, most of our surgeries? And from a health provider standpoint, one of the major reasons why we do have that weight regain is people just resorting back to their old habits. Some of those old habits is, the portion sizes start increasing over time. So say for instance, like with a gastric sleeve, you're actually stretching your stomach again to the size it was originally before the surgery. So overeating is one of the major reasons why people regain their weight. We do have what we call the honeymoon stage after these surgeries, where for the first year you're losing most of your weight, so you're happy, your clothes are fitting nice, you're having more energy. So people get kind of construed with that 1 year honeymoon phase and kind of start relapsing back to their old practices again. So that is one of our major reasons why we do have the weight regain, which is overeating. Another question, what advice would you give to your surgical patients to avoid weight regain? I always say, once you start getting those habits of monitoring what you eat, your portion sizes, so stick to your portion sizes. See a dietitian or a professional nutritionist who can kind of help you with your food selection, your food choices, things to stay away from. People start getting the sweet tooth again, they start eating, desserts and getting back to their old habits. So what I would say to avoid weight regain is to kind of maintain those habits that you have in that first honeymoon phase after surgery, and just kind of watch your calorie intake daily. So I also have another one, which is there a correlation between starting BMI of the patient's weight that result in the most weight regain? There's not really necessarily the reason for having a certain BMI. I think once a patient is motivated to lose weight and to continue their healthy eating habits, I think I'm more sure that it will keep that weight off. So it really doesn't matter how high the BMI or their starting weight. I would say just maintaining their good practices and their good habits, and exercising at least 3 to 4 times a week. Following up with the dietitian, maybe once every 3 months, to make sure that they're on board and sticking to the portion sizes. I highly recommend the weight loss support groups. They usually have a lot of free weight loss support groups within hospitals, clinics. We do have one here at Georgia Surgery Care. Is the third Monday of every month. From 5:30 to 6:30. So I do encourage our patients to usually at least come and stick with a support group. That is just a way of being around people that had the same surgery, and they have questions about nutrition, diets, and stuff like that. So I really recommend a weight loss support group. Another question is, how do I figure out how many calories should I be eating? Normally in the first 2 months, your calorie intake could vary around 400 to 600 calories for the first 2 months, but not to exceed 1,000 calories per day. So with that selection, you're choosing the right foods. You're choosing foods that's low in fat. You're grilling your chicken. You're grilling your fish. So you really have to make good dietary choices. A lot of vegetables, fruits, at least 4 to 5 small meals a day is highly recommended. And drink a lot of water. Water is good for you. At least 64 ounces or more is very good for weight loss, and overall it helps with your good skin and your skin tone. We do also have statistics. So with like the surgery, the gastric bypass, there's a 93% of patients who maintain at least 10% from their baseline weight. Another statistic, 70% maintain 20% of baseline weight loss, meaning the weight that they lose after the surgery, and 40% maintain at least 30% after a 12-year study that was conducted on the gastric bypass. Also, what I highly recommend is exercise Behavioral changes, meaning, you have to change what you're buying from the grocery. You gotta kind of go into your refrigerator, anything that's high calorie, high fat, things that's unhealthy. You do have to do a good inventory and replace them with healthy foods. When you do have healthy foods in your fridge, and that's all that's going to be available, that's what you're going to reach for. So that's another good habit. Also, meal preparation. It is very important to do meal preparation at the beginning of the week, and that way you're not, stopping by the fast food places like McDonald's when you are hungry and selecting those kind of unhealthy foods. So meal preparation, I highly recommend. So these are a lot of the reasons why, patients regain weight, and things that you can do to kind of maintain your weight loss. I mean, we do want you to succeed. A lot of these surgeries are 100%, positive and effective, but you as a patient have to do your work after these surgeries are over. So good dieting, good exercise, food choices, those are things that can kind of help you to be successful after some of these weight loss. And you can also come see me here at Georgia Surgery Care. We do have a good bariatric program here. So if you're struggling and you need help, we do have those resources here for you. If you do have any additional questions, just feel free to go to our website, go on to Facebook, Instagram, and then post your questions on there, and we can address those questions for you in our next session. Give us a call here at the office. We also can address those questions also. And it's good having you guys tune in this afternoon. And like I said, any more questions, just feel free to give us a call, or just post those questions online. So that wraps up our session with Unscripted with Dr. Chris. And again, my name is Sandra Clark, a nurse practitioner here at Georgia Surgery Care. It's a pleasure having you.